the basic model, we follow all the basic medical approach, which is first come up with a diagnosis, and then based on the diagnosis, you come up with treatment options. We always have a treatment plan with treatment goals. So that's pretty standard wherever you go. The key is when you're coming up with a diagnosis, you always start with the history. So for a musculoskeletal condition, to get your diagnosis, you always start with the diagnosis is going to be based on, you first look at the history, and when you say history, you're going with mechanism of injury. The mechanism of injury is all important. Then then the second thing you're always looking at is their symptomatology. And then the last thing you're going to do is, well, not the last thing, is next, based on your symptoms and the mechanism of injury, you're going to get your working diagnosis. And then based on that, you do specific exam tests. So usually, remember, the key to all the diagnosis is 85% of your diagnosis comes from just those two things. All I got to do is talk to them for a few minutes, and I think I know what it is. Now, once I know what it is, I don't have to do this 3-hour exam. I can do literally 4 or 5. Usually it's only 4 or 5 tests, and I've narrowed it down. I'm like, yep, my diagnosis is definitely correct. You know, so if you have a supraspinatus and it's torn, or subscapularis, point your thumb down, I'm going to push on it. If it hurts, could it be other things? Yes. But I know it's definitely, I'm on the right track. If it doesn't hurt, if I can push really hard on that supraspinatus and there's no pain, the chance that there's I just ruled it out. So here we do the exam, and then based on the exam, now I generally have at least a 95% certainty of what that diagnosis is, you know. And then I'm going to usually decide if I'm going to do any diagnostic imaging. Now for a chiropractor, x-rays are super helpful and valuable. You're going to be doing, yes, you will be doing some spinal exams. If you do, we'll generally have taken those x-rays beforehand. And if you need them, you just send them back to the chiropractor, or we have 3 chiropractors here, or wherever you're at, there will be a chiropractor in-house. So you don't really even have to learn how to take the x-rays. You just say, hey, go up front, tell so-and-so you need shoulder x-rays, knee x-rays. But typically they're not even going to refer them to you until the doctor's already given you, in our clinic, you're a support personnel. So your scope is much broader than ours, but we're in a very focused condition. So the chiropractor should never send you a patient unless they already know what they think is wrong and what they want you to do. So really, they're showing up and they're going to say, hey, I think they got a rotator cuff tear. I think they got a torn meniscus, and I want to do PRP. What do you think? And then you get to say, I agree, that's a great idea, or no, we're not doing it, and here's why. Or I think you got the wrong diagnosis. Here's what I think, let's collaborate. And then you're going to send it back. Now, once you do agree or disagree with their diagnosis or their treatment, or you want to talk about something else, 9 times out of 10, you're going to go, yeah, I agree. The doctors we have here, they do this. They can narrow it down, and it's not a really tricky or challenging thing. And you'll send it back and say, I think PRP would be great. That's all you have to do. When you send it back to them, then they're going to put together a treatment plan. Because they're going to be the ones who's doing the laser, and you'll be doing only the parts that are required for you to do. So you'll be doing the injections. And then they'll put together a treatment plan. They'll recommend it to the patient. The patient will decide whether or not they're going to do it. Colton will take care of all the financial arrangements and the scheduling. And then basically the next time you see them, they're going to show up, and Colton will say, here's your treatment plan. Today we're going to hit them with a PRP. 2 weeks from now we're going to do the stem cells. And of course at that point, even though we've already done the treatment program, you will still have, I guess I want to make sure that at any point you're 100% comfortable and never feel any obligation. Oh, they already recommend this treatment program. I don't necessarily agree with it, or I don't think it's going to work, but I got to go along with it. That's never going to happen, and it's illegal if it does, because we don't ever want to pressure you. And honestly, I can't ever see that actually happening. There's not a huge ego here. There, we foster, we criticize the doctors so much. Oh, you're screwing up here. I don't like this. And they argue right back. So if you ever felt any ethical issues, you immediately mention it to Colton or me or anybody and say, hey, I got a problem with this. I can't remember anybody ever saying, I have people who say I'm nervous too because I don't want to get in trouble, but then we go, oh, you're going to get in trouble for not.
Yeah.
You did the exam, you're very certain you're on the right track. This is when you're going to do the diagnostic imaging. This has two purposes for diagnostic imaging. Number one, it's going to confirm our diagnosis. We want to see the tear. We know it's there, but we don't know how bad it is. So it's going to confirm or disapprove and say, no, this is not what's wrong. That's rare. And it's going to tell us the severity. So we know we got a torn supraspinatus. Can you see it? Most of the times you can't, but sometimes you can see it and you're going to go, oh, it's a grade 1 tear or grade 2 tear or grade 3 tear, or this one's not going to respond. I mean, we could do stem cells, but this needs surgical intervention. Or there's a bursitis there too. So it's going to tell us all the complicating factors as well. And that's what we're going to do. So like I said, x-rays, before they get to this point, either the doctor's already done the x-rays and you get to look at them. So pretty typically with the shoulder, like if you're going to do knees, the first thing we're going to do when they have a chronic knee problem is take x-rays because we want to see the most common reason is degenerative osteoarthritis. And you want to see how much cartilage is left. Okay, any questions about this? So, mechanism of injury. I want to talk about, it's about 5 minutes. I want to get into these specifics.